All right, so I need to range somebody's neck, and let's see if I can. Am I in there now?
You're in there, but
Yeah, don't worry about this right now. So I've got ranges in my neck, and there's this, and that is rotation. Ear to shoulder is going to be side bending. Chin to chest is flexion. Chin to the ceiling is extension. Okay, so rotation, side bending, flexion, extension. All right, when I look at my spine, what's this red thing in there?
vein or artery.
It's an artery. It's a vertebral artery. So somebody come up here and help me out. Come on over. Where is it? Where's that artery running?
Inside the
It's
vertebrae.
inside the vertebrae. Okay? So if I rotate or side bend or extend or flex, or if I extend and rotate and side bend all at the same time, what's happening to that artery? It's banging around inside there. So I always worry about what happens in arteries as we get older. They start to get stenotic, they start to narrow, plaques get in them. So if I bang that thing shut by extending or rotating, I can break off a plaque and I can give you a stroke. Or I can rupture that vertebral artery, okay, dissect it, make the sides of the walls stick together. Have we talked about arterial dissection? Did we talk about that? Okay, so when that artery closes shut and the inside linings touch against each other, sometimes the outside lining pops back out and the inside lining stays stuck to the inside lining and you've dissected. Okay, so we are concerned about doing that with people. And so we're going to do, how often does that happen? Not terribly. You know, I work in a neurological hospital, and I think the most I've ever had in a year was 4, and the fewest is none. So on average, I see someone every year that's gone to the chiropractor and have their neck manipulated and popped, and they pop their neck and break off a plaque and give them a stroke. The highest incidence is 30-year-old women. I don't know if that's because more women in their 30s go to the chiropractor than don't. And it could happen to anyone, but that's everyone I've ever seen that's had a stroke from a neck manipulation has happened on the table at the chiropractor's office when they've manipulated their neck and they've caused an embolism to go to their brain and give them a stroke. So we're going to do, on page 106, there's a vertebral artery occlusion test. So we're wanting to try to decrease the likelihood that happens to us with our patients. One way we decrease that chance of happening to us is that PTs don't typically as aggressively manipulate. PTs are allowed to manipulate necks. We're allowed to pop necks, and there are PTs that do it, that are really good at it. There are times when it's appropriate to go to the chiropractor and get your neck manipulated if you've got facets that have jumped and are, not in the proper place. It might be appropriate to have your neck manipulated. PT tends to go a little bit more less aggressive to get that range. If the range is not there, we tend to get it more slowly with more gradual mobilizations. So in the PT world, and this is next semester kind of stuff, but as we stretch those joints or we stretch elbows, we grade those. And what we were doing today is grade 1 mobilization, just range of motion. Okay, when we start popping, that's called manipulation. There's all sorts of levels in between. Okay, so we tend to do it with more gradual mobilization and tend not to manipulate as much, but PTs do sometimes manipulate. So I need someone to lay up here with their head on their back, somebody supine up here. Perfect. All right. So what this procedure 6.3 in my book is talking about is it's going to have me gradually increase the range of motion, and I'm going to look for signs that he's got something in there that's preventing blood's normal flow. Because if he's got normal flow in his neck, moving it all around is not going to be a problem. If he's got, you hear about people that went to the doctor and they had 70 or 80% occlusion. If you've got 70 or 80% occlusion and I tip your head back, I might prevent some of the blood from getting to your brain. So what are symptoms of that going to be? You can be dizzy, you can be lightheaded, you may start sweating, you may, all sorts of things. You may affect your vision, you may start getting blurred vision. So those are the kinds of things we're going to look for. And I'm trying my darndest to, I always do this sitting, but I'm going to try to do it up here so we can see what's going on. So the first thing I'm going to do is hold his head and just get support. He needs to know that I've got him and I'm not going to let him go, because I'm getting ready to drop this thing out of your way, okay? So just relax for a second. I want this out of my way. Okay, so now I've got him completely supported. I want him to relax and trust me. So it tells me, position the person as he or she is in supine and passively perform the following movements. Full head and neck extension. So I'm going to let his head come all the way down. I'm going to bring it up maybe a little bit and bring it down again. I'm going to hold it down here for about 10 seconds. And I'm going to ask him, hey, I'm looking for dizziness, lightheaded, blurry vision, anything? Any problems? All right. So after I had him down there for 10 seconds, I'm going to ask him that. He says, no, I can continue to go. Full head and neck rotation to the left and right. So now I'm going to go left rotation. That's the next most aggressive rotation. I'm going to hold it for about 10 seconds. I'm going to ask him, dizziness, lightheadedness? Okay, I'm going to come back to the middle. I'm going to go all the way to the right. At any point during this, if you get lightheaded or dizzy or blurred vision or something, you just need to let me know. We'll stop. Okay, feeling all right?
Yeah.
All right, so we're back to neutral. We're going to wait a second. Now I can do, so I did full head and neck rotation to the left and right with the head in extension. So now this is the money shot, right? So I'm going to go full extension with rotation. That's the most likely position to occlude his vertebral arteries. I'm going to hold for 10 seconds. Any symptoms?
No.
Okay. Same thing, down and back, extension with rotation. I'm supporting his head so he doesn't feel like it's going to fall off. 10 seconds, back up. You all right?
Yep.
Okay, so now he's cleared. I've cleared his cervical spine. I did the vertebral artery occlusion test, the VAOT. Now I can do my range of motion. Now I can do my side bending. I can do my rotation. I'm probably not going to do extension with rotation as an activity. I'm going to split it back up into the motions. There's flexion and extension. I'll do those. I'll do rotation from neutral. I'll do side bending from neutral. Okay. Why would a PTA be doing this? Could be a couple of reasons. Hey, I want you to go in there and do an ultrasound on his neck, clear his vertebral, do a vertebral artery occlusion test for me, because I'm going to come in later and aggressively range him. Okay, so you do that for me. You say he has nothing. You've done your ultrasound. I'm going to come in immediately and start doing my work. Oftentimes I don't have time. If you're trying to pretty aggressively range, you might want to do that. If I have someone and they've had whiplash and we're just going to be doing some supine, gentle stretching here, I don't need to go through the whole process. It's more when I'm getting a little bit more aggressive with my ranges and I'm going to start mobilizing the spine. If your clinician says, we're going to do MOBs today, and we're going to do some pretty aggressive MOBs, 3s and 4s, 5 is manipulation. Can you clear their cervical spine for me? You're going to do this vertebral artery occlusion test. You could potentially go through your whole practice without ever doing this on a patient. if you're going to the chiropractor and they're manipulating your neck and they haven't ever cleared it, you wonder, and they'll tell you it's no big deal, right? No, that's much doing. But I've seen at least a dozen strokes in my practice from cervical manipulations. When I'm here, I can do these ranges as long as I'm supporting. I can even provide just the slightest bit of traction. I can stretch his traps. I can stretch his shoulders a little bit while I'm doing this. Okay. So what I want you to do is